Have you ever stood up from a chair and felt just a little unsteady? Not a dramatic dizzy spell, not a collapse, just that brief moment where your body does not feel as sure as it used to. Or maybe you wake up during the night feeling groggy, heavy, or not fully alert. Maybe your energy has been lower lately, even after a full night in bed. Maybe you find yourself moving more carefully, holding the wall for a second, or wondering why you feel off when nothing obvious has changed. For many people over 60, the first explanation is simple. It must be aging. And sometimes age does play a role. But after 60, there is another possibility that is easy to miss. It may be connected to your medication list, not necessarily one pill, not necessarily a mistake by your doctor, and not because medication is bad. Many medicines are essential. They control blood pressure, protect the heart, manage diabetes, reduce pain, prevent clots, and help people live longer and better lives. But as the years go by, prescriptions can accumulate. Then come the over-the-counter pain relievers, the allergy pills, the sleep aids, the stomach medicines, the vitamins, the minerals, and the supplements. One doctor adds something, another doctor adjusts something else. A medicine started years ago stays on the list. A supplement becomes part of the morning routine. And slowly, without anyone meaning for it to happen, the list gets longer. The real mistake is not taking medicine. The mistake is taking more and more pills after 60 without a careful review of whether every item is still needed, whether the dose still fits your body, and whether the combination may be affecting your balance, sleep, alertness, or energy. This is one of the quietest problems in senior health because it does not always announce itself clearly. It may show up as mild dizziness, a little more daytime fatigue, a slower walk, a foggy morning, a near fall in the hallway, a feeling that your body is not responding as quickly as it used to. And because these changes are common after 60, many people never ask a very important question. Could something I take every day be part of what I'm feeling? As we age, the body does not handle medicine exactly the same way it did at 40 or 50. The liver and kidneys may process certain medications more slowly. Muscle mass changes, body water changes, the brain can become more sensitive to medicines that affect alertness or coordination. So a dose that once seemed perfectly fine may feel stronger later in life. A nighttime medicine may still be affecting you the next morning. A pill that once caused no problem may become harder to tolerate when combined with 3 or 4 others. That does not mean you should stop taking anything on your own. Some medications can be dangerous to stop suddenly, but it does mean your medication list should not be treated like something permanent and untouchable. It should be reviewed as your body changes. One of the biggest misunderstandings is the idea that familiar medicines are automatically harmless. Many people are cautious with prescriptions but much more relaxed with over-the-counter products. They may take an allergy pill for sleep, a pain reliever for arthritis, a stomach medicine after meals, a supplement for memory, and maybe something else for nighttime leg cramps or relaxation. Each one may seem small, but your body does not experience them as separate little decisions. Your body experiences the full combination. And sometimes that full combination can affect how steady you feel on your feet, how clearly you wake up, how deeply you sleep, how fast you react, and how much energy you have during the day. Balance, especially after 60, is not just about strong legs. Balance depends on your brain, your eyes, your inner ear, your nerves, your muscles, your blood pressure, your hydration, your blood sugar, and your reaction time. If a medication makes you sleepy, lightheaded, foggy, weak, or slower to respond, even a little, that can matter, especially at night. Think about the simple act of getting up to use the bathroom. The room is dark. You may be half asleep. You stand up quickly. Your blood pressure may shift. Your slippers may not be secure. There may be a rug, a cord, or a chair in the way. Now add grogginess from a medication or sleep aid. That is not something to panic about, but it is something to take seriously. Falls after 60 can change a person's confidence. Even a fall without a major injury can make someone move less, avoid walking, become weaker, and feel less independent. That is why mild dizziness, morning fogginess, or new unsteadiness deserves attention. One possible reason is sedation. Some medicines slow down the nervous system. That can be useful in the right situation. These medicines may be used for sleep, anxiety, pain, muscle spasms, or other medical conditions. But in older adults, the sedating effects can sometimes last longer than expected. You may not feel drugged, you may simply feel slower, heavier, less sharp, or less steady. Another possible reason is a drop in blood pressure when standing. Some people feel lightheaded when they rise from bed, get up from a chair, or step out of the shower. This can have several causes, including dehydration, heart rhythm problems, blood sugar changes, and medication effects. Blood pressure medicines can be very important and should not be stopped without medical guidance. But if dizziness begins after a medication change or becomes a repeated pattern when standing, it is worth asking your doctor about. Another issue involves medicines with anticholinergic effects. That term sounds complicated, but the idea is simple. Some medicines can interfere with chemical signals that help the body manage alertness, memory, digestion, urination, eye focusing, and other functions. In older adults, these effects can sometimes show up as dry mouth, constipation, blurred vision, trouble urinating, confusion, lightheadedness, or balance problems. These effects may come from certain bladder medicines, older allergy medicines, some sleep products, some antidepressants, and other medications. The point is not that every medicine in these categories is dangerous for every person. The point is that side effects can sometimes look like just getting older, and when that happens, people may miss the connection. There is also something called a prescribing cascade. This happens when a medicine causes a side effect, but the side effect is mistaken for a brand new problem. Then another medicine is added to treat that symptom. Later, that second medicine may cause another issue, and the list grows again. For example, a medication may contribute to dizziness, constipation, sleepiness, or swelling. Instead of asking whether the first medicine could be involved, another pill gets added. Over time, the person ends up with a more complicated medication routine and more chances for side effects or interactions. This is why, after 60, one of the most useful questions is not always, "What new medicine do I need?" Sometimes the better question is, "Could anything I already take be contributing to this?" Sleep is a perfect example. Many older adults have trouble sleeping. They may struggle to fall asleep, wake up too often, or feel unrefreshed in the morning. So they reach for something that promises rest, a sleep aid, an antihistamine, a supplement, or sometimes alcohol. But some products that make you sleepy can also leave you foggy the next day. They may reduce alertness, slow reaction time, or make balance worse when you get up at night or early in the morning, and the pattern can become confusing. Are you tired because you slept poorly? Because a medicine disrupted your sleep? Because a sleep aid lingered too long? Because of pain, blood sugar, sleep apnea, depression, or another medical issue? The answer is not always obvious. That is why guessing is not the safest approach. A careful medication review can help sort out the possibilities. Energy works the same way. Low energy after 60 can come from many causes: poor sleep, anemia, thyroid problems, heart disease, depression, dehydration, infection, blood sugar changes, nutrition issues, low activity, and many other conditions can play a role. Medication side effects are only one possible factor, but they are an important one because they are often overlooked. A person may say, "I'm just tired all the time," but the details matter. Did the tiredness begin after a new prescription? Did it worsen after a dose was increased? Is it strongest in the morning after taking something at night? Does it come with dizziness, constipation, confusion, blurred vision, or unsteadiness? Those patterns are worth writing down, not to diagnose yourself, not to blame one pill, but to give your doctor or pharmacist a clearer picture. There are certain signs that deserve attention. If dizziness begins after starting a new medication, mention it. If your balance worsens after a dose change, mention it. If you have new confusion, unusual sleepiness, blurred vision, weakness, or a fall, do not simply brush it off. Near falls matter too. Many people only tell their doctor if they actually hit the floor. But grabbing the wall, stumbling in the hallway, missing a step, or suddenly feeling unsafe on your feet can be an early warning sign. The cause may be vision, it may be muscle weakness, it may be blood pressure, it may be dehydration, it may be an inner ear issue, it may be nerve problems, it may be medication, or it may be several things working together. That is why the goal is not to guess. The goal is to bring the pattern to someone qualified to review it. One of the safest habits after 60 is keeping an updated medication list. Not just prescriptions. Include over-the-counter medicines, vitamins, minerals, herbal products, sleep aids, pain relievers, allergy pills, stomach medicines, eye drops, and anything you take only once in a while. Write down the name, the dose, when you take it, why you take it, and who recommended it. This sounds simple, but it can prevent a lot of confusion. Many older adults see more than one doctor. A primary care doctor may prescribe one medicine, a cardiologist may add another, a specialist may adjust something else, an urgent care visit may add a short-term medication, and unless the full list is reviewed, no single person may see the whole picture. A pharmacist can also be very helpful. Pharmacists are trained to look for interactions, duplicate medications, risky combinations, and medicines that may need extra caution in older adults. When possible, using one pharmacy can also help. It keeps more of your medication record in one place. It will not automatically catch supplements or products bought elsewhere, but it improves the chance that a potential issue will be noticed. Another good habit is asking for a medication review at least once a year, and sooner if something changes. Good times to ask include after a fall, after a hospital visit, after an emergency room visit, after starting a new medicine, after changing a dose, or after noticing new dizziness, sleepiness, confusion, weakness, or low energy. The conversation does not have to be complicated. You can say, could any of my medicines be affecting my balance? Or, do I still need everything on this list? Or, could anything I take at night make me groggy in the morning? Or, could any of these interact with my supplements? Or, is this dose still appropriate for my age, kidney function, and fall risk? These are not difficult questions. They are responsible questions, and they do not mean you are challenging your doctor. They mean you are taking an active role in your safety. The goal is not fewer medicines at any cost. The goal is the right medicines, at the right dose, for the right reason, with the lowest reasonable risk. Some people genuinely need several medications: heart disease, diabetes, blood pressure, blood clots, thyroid disease, pain conditions, mood disorders, and other health issues may require treatment. For many people, medication is not optional, it is protective. The risk is not simply the number of pills, the risk is taking them without coordination, without review, or without recognizing that side effects can change over time. Supplements deserve the same attention. Many people do not think of supplements as medicine, but your body still has to process them. Supplements can sometimes affect bleeding risk, blood sugar, blood pressure, sleepiness, or how another medicine works. Natural does not always mean interaction-free, so if you take supplements, tell your doctor and pharmacist. Do not leave them off the list because they seem harmless. They may matter, especially if you take blood thinners, diabetes medication, blood pressure medicine, sleep medicine, or pain medication. And this needs to be said clearly. Never stop a prescribed medication on your own because of something you heard in a video. Some medicines need to be reduced gradually. Some protect you from stroke, heart attack, seizures, blood clots, dangerous blood pressure changes, or other serious problems. Stopping suddenly can be dangerous. The safer step is to say, I'm having this symptom. Could we review whether any medication might be contributing? That is the kind of question that can open the right conversation. There are also symptoms that should be treated as urgent. If dizziness comes with chest pain, shortness of breath, fainting, a new irregular heartbeat, sudden weakness on one side of the body, trouble speaking, sudden vision changes, seizure, severe headache, or a head injury after a fall, seek urgent medical help. Those symptoms may involve something much more serious than medication side effects. For symptoms that are less sudden but persistent, such as repeated lightheadedness, worsening balance, unusual fatigue, morning grogginess, or new confusion, make an appointment. Do not let weeks or months pass while telling yourself it is only age. Aging may change the body, but it should not become an excuse to ignore new signals. The main lesson is simple. After 60, your medication list needs to age with you. What helped you years ago may still be exactly right, but your body may have changed. Your sleep may have changed. Your kidney function may have changed. Your fall risk may have changed. Your other prescriptions may have changed. So the plan deserves a fresh look. Not because medicines are the enemy, but because safety depends on the whole picture. A pill that is reasonable for one person may not be right for another. A dose that fits at one stage of life may need review later. A supplement that seems harmless may matter when combined with certain prescriptions. So if you are over 60 and you feel more tired, more unsteady, more foggy, or less refreshed than you used to, do not jump to conclusions. It may be sleep. It may be circulation. It may be blood sugar. It may be vision, nerves, dehydration, muscle loss, or another medical condition. But one possible factor worth checking is your medication list. Sometimes the hidden signal is not that your body is simply getting older. Sometimes the signal is that your body is asking for a review. A review of what you take, when you take it, why you take it, and whether the full combination still fits the person you are. Today, at your next visit, bring the bottles, bring the list, bring the supplements, bring the over-the-counter products, and bring the symptoms you have noticed. Even if they seem small, a small conversation can sometimes prevent a much bigger problem. Do not stop your medication on your own. Do not ignore symptoms that begin after medication changes. Ask for a careful review. Ask whether anything could be affecting your balance, sleep, alertness, or energy. And make sure every pill still has a clear purpose. That is not fear. That is good health maintenance after 60. And if you want more calm, clear, and practical explanations about the body signals that matter as we age, subscribe for more videos on health after 60.